Hi, we did healthcare support. Me and Layla were in the dental care centre next to Malton Hall.
We worked in different areas of the allied health professionals, which is mainly physiotherapy, speech therapy and occupational therapy.
We were with the estates for 3 days, which was a really great experience for us. And for those of you who don't know what the estates department do, is they look after the fabric of the NHS buildings.
Hi, I'm Johnny Johnson. I'm an estates officer with NHS D&G.
Hi, I'm Luca Firmus. I'm from Walsall Academy. So over the past 3 days we've been going all about the place, and in DGRI, Mountain Hall. You know, I was really getting a feel for everything that we had to do there. Obviously the estates department, nobody really speaks about it, but it's actually really interesting how much work they do and how little they're recognised. So
I thought that both boys were really good, really engaging with the full department. Hopefully they've learnt quite a lot this week from all the different people throughout the estates department. As we say, there's 40 members of staff, and each and every one of us plays a key point within the team. So hopefully they can take a little bit from each of us and go on and get a good career.
Yeah. We also got the opportunity to experience what it's like to sit in a HR meeting and development session. What we found is it's quite interesting with the short course if you know that you want to work in healthcare but you maybe don't know the route you want to go down, because I find it quite interesting in a lot of things that I never thought about that I could go into.
So we looked at how much bacteria was on our hands, like before and after washing our hands on an agar plate, and then we filtered tap water through a filter and then put the thing.
Me and Megan were at the new hospital and Natasha was at Mountain Hall and we were working in the cafeterias.
So our placement was in the Department of Medical Physics, so the following are the functions of this department. So they make sure that...
I'm Jerry Boyle and I'm the Renal Technical Manager in Medical Physics in Dumfries and Galloway, Royal Infirmary.
I'm Mohammed and I'm from St Joseph's College and I'm in S4 currently. Yeah, so basically the area that I was under the supervision of was medical physics, and basically what they do as a department is that they have the responsibility of maintaining and basically ensuring safety of these machines that have been constantly used in patients, and it's quite a critical role in the NHS, because if these machines were faulty or were to have an issue in them, this could cause serious harm to the patient.
One of the big challenges that we have in the NHS throughout Scotland is that we've got a population of employee that's becoming richer in years, and I'm right up there at the far end of that spectrum, and we have to find some way of encouraging younger people to come into this discipline, and I think that this is a fantastic way to encourage people, to let them see that there's more to the NHS than just the nursing and the medical careers that are the headline careers. We've had a fantastic day today, and there's some fantastic presentations and really enthusiastic people, and it gives me a lot of hope.
Before I went on this program, I always thought that the main roles in the hospital were just the doctors and the nurses. I never really appreciated the rest of the staff.
So we didn't realise the department actually has a lot entailed in it. So we have CT, MRI.
The patients. Then the orders start with pulse, and when doing that you count his breathing for 1 minute as well.
So most of us were in DGRI, however some of us were at Mountain Hall, and we shadowed nurses around the hospital watching closely what they do.
What is Home Teams? It's a health and social care model of working which is being used in Dumfries and Galloway to help people live happier and healthier lives in their own home.
What exactly do public health workers actually do? They try to understand local health and well-being needs and priorities and support the development of a community response.
That is, both GP and the hospital, they both work together to keep their patients safe and sound.
Hi there, my name is George McGeoch.
Hi, my name's Layla. Hi, I'm Freya Pardo.
Hi, Ken Donaldson.
So my experience has been all the way from secretary work into visiting the patients at their own homes and looking at all their different conditions. we were described as medical students. We didn't know very many medical terms, but we tried our best.
So we were within a hospital and we got to look at many specialities such as surgery, got to talk to people such as anaesthetists and also just general doctors, and also establishing the roles of doctors within a hospital and getting to learn more about what they do.
Yeah, as Freya said, it was really interesting to see how doctors and nurses and everyone just like works together to find out what the best solution would be for the patient.
It's really guided my own vision into seeing what sort of care I'd like to go into, if it's primary care or secondary care, looking at more serious or lesser serious cases.
For me, it's overall just confirmed that medicine is definitely the career path I want to go down, and also having a look into different specialities helped me learn more about those and seeing what ones maybe I'd like to go into more than others.
Yeah, it was really eye-opening. I knew that I wanted to do medicine, but this has gotten me so much more interested in it, and it's opened my eyes a lot to medicine overall, and I 110% want to do medicine.
So yeah, I'm Ken Donaldson, I'm the medical director here at NHS Dumfries and Galloway, and it's been a fantastic afternoon just hearing the experience of lots of school students, in particular for me, though, hearing about those that have been doing the medical block, because we know there's a lot of school students out there who might be thinking about doing medicine, but they're just not sure, and this opportunity to actually see what it offers in the different range I think is really invaluable. We're really keen that we get people locally who are getting into medical school. Obviously our hope is they might come back to Dumfries and Galloway in the future, because we really want to boost our recruitment numbers, and this I see as a very kind of start of that. So it's been a really encouraging afternoon.
My name's Kelsey, this is Thomas and this is Zara, and today we have a 2-minute video to show you what we learned.
So we each spent a morning in the CAU, which is Critical Assessment Unit. So in CAU we experienced how the pharmacists work with other healthcare professionals.
Ophthalmology is a surgical subspecialty within medicine that deals with the diagnosis and treatment of eye disorders such as
On the second day, we re-imaged computers. That's a process that...
The recruitment team is split into two. Vacancy side, they basically assist managers with advertising posts after approval.
So I'm Christine Patterson, I'm the recruitment team lead for NHS Dumfries and Galloway, and I'm based at Mountain Hall.
I'm Kayla Milligan. I am a fifth year pupil at North West Community Campus.
I think this is a great opportunity for our young people to attend work experience with NHS. I would say that the 4th, 5th and 6th years that are in school now, they missed out a lot due to COVID-19. So this opportunity is giving them lots of a chance to get in at the workplace and see what the NHS has got to offer. Workforce sustainability and recruitment, we hope we have provided our young people with a good insight into the whole board, what type of posts we have available, and yeah, I hope they've enjoyed it. It's been good to have them.
I had no idea that they had a whole department for that beforehand, so it was quite interesting to learn about international nursing and everything that goes into that department. I really enjoyed it.